Last week, I have a really good opportunity to join an obstetric emergency training that my current hospital provided to us, all of the midwife, and I found it really helpful that the course can help me prepare and learn a lot about the hospital protocol and how to deal with each scenarios. APH is a bleeding situation that can happen during pregnancy. There are many causes that can cause APH. Assume that you are a midwife working at the maternity assessment unit, and there's a woman come in to you and tell you that she came because of the vaginal bleeding. What will you do? So in Australia, we call code blue. In this situation, you might consider to put 2 IV access for her. Make sure that you also explain to her as well of what is happening. It is emergency and your heartbeat might be pumping really hard, but try to be calm as much as you can. Hello everyone, welcome back again to my channel. You are with me again, Julia. If you don't know me, I am an overseas qualified midwife that migrated to Australia through the OBE pathway. If you are also overseas midwives and plan to migrate to Australia as well, stay tuned and don't forget to subscribe to my channel and you won't miss any information from me. In today's video, I'll talk about APH or Antepartum hemorrhage, and this video will be a part of my Midwifery OSCE Preparation Checklists, so feel free to check out in my channel as well. Last week, I have a really good opportunity to join an obstetric emergency training that my current hospital provided to us, all of the midwife, and I found it really helpful that the course can help me prepare and learn a lot about the hospital protocol and how to deal with each scenarios, and APH is one of that we got trained for, so I would love to talk about it today. As you already know, APH is a bleeding situation that can happen during pregnancy. There are many causes that can cause APH, but mainly I would say there's the placenta previa, which is the painless bleeding. It can be the placental abruption, which is the painful bleeding, and it can be because of the vasa previa, or it can be other obstetric related like bleeding from the vaginal canal, something like that. To be honest, I do not have much experience regarding the APH scenario in Australia as a midwife, so if I can give you some example, let's say assume that you are a midwife working at the maternity assessment unit, and there's a woman come in to you and tell you that she came because of the vaginal bleeding. What will you do? To practice, you can pause the video and comment down below of what you're gonna do with her, and after that we can continue. Okay, you ready? In 3, 2, 1, let's continue. So if you have a woman come in because of the vaginal bleeding, to start with, before you approach her, you make sure that you do the hand hygiene, you introduce yourself to her. Hi, I'm Julia, I'm the midwife on duty today. Can you tell me your full name and date of birth, please? So she'll tell you her full name, her date of birth, and ask her, what brings you here today? And she might say, I have a vaginal bleeding and I'm so painful, I have an abdominal pain, I don't know what happened to me, can you help me, blah blah blah. Then you need to check her pad, you need to check her bleeding, ask her how many pads have you used today, since in the past how many hours, and she might say, I change my pad every hour, it's okay, and you might ask if you can have a look on her pad. So you need to check her blood, is it fresh blood, is it an old blood, how is the amount, is it soaked pad fully, or it might be just a little bit of spotting on the pad. And you might need to also check if there is any blood clots. You can ask her as well, any blood clots, any smell, and if you can see that it is an emergency situation, she have a really severe vaginal bleeding, you need to call for help. So in Australia, we call code blue. Code blue is a medical emergency, or you can also press the emergency button. Normally it will be at the top of the bed, so press the emergency buzzer and then everyone will come and help you. Once you call for help, the person that you expect to be there will be your senior midwife, will be another midwife as well, to help with everything, to help with scribe, and also obstetrician should be there, anesthetist should be there, and if you can feel like she need to go to, she gonna deliver her baby, you also need to inform pediatrician as well. So at least 5 persons should be there to help you. While you're waiting for the help to arrive, you also need to assess her and get some information from her as well. So you need to ask about when did the bleeding start and what were you doing when the bleeding started. Were you sleep on the bed, watching TV, or you been to any trauma, any accident? Do you feel safe at home, just to make sure that is there any cause of the bleeding. And then you need to ask how many gestation are you today, when is your due date. If she is over, let's say 28 weeks, you need to put her on the CTG. But in Australia, in many hospitals, they start from 25 or 26 weeks. So in that cases, you might consider to put her on the CTG as well. And also to check baby, did you feel baby movement today? She might say, oh no, I haven't feel any baby moving when I start having the bleeding. So after that, you need to assess and do some action to her. So you need to check her observation and also you check baby after. So check her observation, check her blood pressure, heart rate, the full set. She might have a low hypo blood pressure. She might have 80 on 50, for example. Heart rate might go up to 120. The rest of them might still in the normal range. And you put her on the CTG. You might see that the CTG is not reassuring. You might see that its variability is reduced from normal, doesn't have any acceleration. So in that case, you might consider to lie her on the side. We recommend to do the left lateral, and you might consider to start giving her the high flow oxygen as well. We do 10 to 15 liters per minute. And also you need to feel her belly as well. So you need to do like a gentle abdominal palpation to see if she having any contraction or she have a tense or hard uterus, because that will tell you that if she have concealed blood inside or she have like some sort of the abruptio placenta, because she might feel painful to touch, tender to touch, and she won't let you touch her belly at all because she is really in pain. So yes, just need to consider that, and also you need to see if she have any contraction or not. Okay. After that, you might consider to scale her blood pair to see how much bleeding she's been having so far. And if she still have active bleeding, you might consider to fast her, because if she need to go to the emergency operation, you need to fast her. So let's say you fast her from now, or you can ask her when was the last time that you eat and drink, so you know when was the last time that she fast, when was the time that she start fasting. Okay. After that, you need to do some procedure to her as well, because in this scenario like this, she are likely to go to the operating theater quite emergency. So in this situation, you might consider to put 2 IV access for her. So if she have an active bleeding like this, the protocol will recommend to put the 16 gauge, 2 IV access on one of each side. And when you put that in, you also need to take blood from her as well. So blood we need to send for the FBE, we need to send for the coagulation, cross-match, and if she having a negative blood group, you might consider doing the Haemorrhage test as well. After that, you're gonna consider to give her some IV fluids. So different hospitals have different policies of what fluid to be given, but mostly it will be the Hartmann solution, and it can be 500 ml bolus and followed by the drip. Or some hospitals have different policies, so go have a look on that as well. But consider giving her IV fluids for resuscitation, and also you can move on and put the IDC in for her as well, the catheter, because once she having the vaginal bleeding, we are doing the resuscitation, we give her the fluid, so we need to see the urine output as well and make sure that the output is over 30 ml per hour. Okay. And also we might consider doing the speculum. Midwife can be the one doing it, or doctor can do it as well. So then we can assess the site of the bleeding, and we can assess the cervix if the cervix is dilated or not. And I think we did prepare everything for her in order to go to the operating theater in this emergency situation. Make sure that you also explain to her as well of what is happening. I would recommend to explain to her step by step when you do the procedure, so she can understand and you get consent from her as well of what you are doing and why you need to do each of that. Let's say why you need to put the cannula in, why you need to take blood and send it to the lab, why you need to put the catheter in for her. Like, explain to her when you do things as well, so she understands what is happening. She might ask you, how is my baby going? Is my baby gonna be okay? So you need to know how to explain to her and don't make her panic. I know in this situation like this, it is emergency and your heartbeat might be pumping really hard. But try to be calm as much as you can, because if you panic, you make her panic as well. So try to be calm as much as you can. Try to do things and cover everything as much as you can, and I think that is the best that you can do. And once your help arrive, you know how to hand over to them, and you know what else that you can do for her. Okay? Some more things to consider as well if the woman gonna have a preterm delivery. If her gestation is less than 30 weeks, the protocol would recommend to give the magnesium sulfate to her for baby neuroprotection. If her gestation is less than 34 weeks, you're gonna consider to give her some of the steroid, the betamethasone. And also, if she's having the Rh negative blood group, you're going to consider giving her the anti-D immunoglobulin as well, just to prevent her from not producing the antibodies against baby if baby have the positive blood group. Okay? Alright, I think that's the assessment, action and management that we can do for the APH situation. Remember, try to be calm as much as you can, because if you stress and you panic, you will make the woman stress and panic as well. I know your heartbeat may be pumping really fast, but try to be calm as much as you can. Also, remember to call for help. If it is something that emergency and you think you cannot do everything by yourself, call for help. Start with call for help, and when the helps arrive, everything will get better, because you need more hands to do stuff in the emergency situation like this. And don't forget about the woman-centered care as well. So talk to her about things that you do to her, and make sure that you get her consent. Make sure that you focus on her and she understands what's going on with her, and she understands and she accepts and she consents for you to do things to her. Okay? Okay, how is it? Is your answer similar to these guidelines? Feel free to comment down below if you feel like there's something else to add on to make it better, so that you can share it with me and other midwives who are on the process as well. Otherwise, thank you so much for watching until the end. Feel free to give me a thumbs up if you like this video. Comment down below if you need any other information about APH, or you need some more information about another scenario as well. And feel free to share this video with your friends if they are on the process, and if you think this is going to be helpful for them. And I will see you in the next video. Bye bye for now.